And good morning to you, St. Lucia. It's always an absolute pleasure to have you tune in to the National Television Network here at the studios of the Government Information Service. It is that time. It's for your morning update with Lucia and Homer. It has been overnight quite eventful. As you know, we're continuing our national fight against the COVID-19 pandemic. And every day the struggle continues, the national conversations surrounding that, as well as on the fallouts from COVID-19. And Homer, good morning to you.
Good morning, Lisa.
And I was about to say that certainly for anyone who would have tuned in to our conversation with Dr. Merle Clark, the president for the St. Lucia Medical and Dental Association, that conversation yesterday, they would have gotten a full understanding of the sort of dynamics involved with the fallouts for COVID-19. I mean, she spoke very openly about the impact on the healthcare professionals, even the idea now of people leaving. So we're seeing that we are being impacted by the poaching tactics of countries who are better able to provide very lucrative packages to our medical professionals, and especially for nurses, and they are choosing to go on to greener pastures, if you will.
And she really did paint a picture for us and clarified a number of things, I think, a number of questions many people had in terms of the vaccines, in terms of the variants and how they relate to the vaccines. And we have to thank her for that. She really did paint a colorful picture. So if you missed that, of course, you could always head over to our Facebook and YouTube channels, Government of St. Lucia, and check it out. Our prior episodes, our previous episodes are always posted there. And let me say a big good morning to those of you watching us on channel 122 as well. Speaking of COVID-19, we do have an update from the Ministry of Health, Wellness and Elderly Affairs with COVID-19 figures. But just before I get to that, we're in the midst of the Nobel Laureate Festival that's currently happening. So let me just update you very quickly based on the calendar, some of the activities going on there. So Monday and Wednesday, metaphorically speaking, that is going to be taking place with Delia Dolor. St. Lucia as a metaphor, she's going to be speaking with John Robert Lee, and we had her on the show a little earlier on in the week.
That would have been Monday.
Monday, right. And talking about the Nobel Laureate Festival. And she kind of piqued our interest very much when it comes to metaphorically speaking. They're going to be sharing certain facts about St. Lucia that, we may not be aware of. So you could definitely tune in for that. You could check out the Nobel Laureate Festival page on Facebook as well as YouTube. I believe these episodes should be available
there as well.
Very important happening on Tuesday, the Derek Walcott Memorial Lecture, which is a staple, a part of the Nobel Laureate Festival. It's going to be delivered this year by Mr. Kendall Hippolyte, and it's called The Demand of Beauty. So that is the one that you could take in 7:30 at the Finance Administrative Center, Point Seraphim in Castries. Social distancing protocols will apply. So if you do wish to attend the lecture, you do need to give them a call in advance to reserve your seat, because as you know, we're in the midst of the COVID-19 pandemic. Sitting will be very, very limited, but you can always join online, and you can do so, again, Nobel Laureate Festival St. Lucia on Facebook or YouTube, and you should be able to get in there. Going on to, Lisa, the COVID-19 cases that the Ministry of Health and Wellness...
But before you do that, I just want to remind, and just keeping in line with celebrating St. Lucia's excellence, don't forget that the nomination process for the National Awards, Independence Awards, that process is open, and you can go on to the National Independence Awards Committee's a Facebook page to get nomination of forms there. Also, it is with the Office of the Prime Minister, so you can get the nomination forms there as well. And the process closes on January 28th. So we want to be able to have as many St. Lucians as possible nominated so that we can award the St. Lucians who have really been striving and building, contributing to the building of the nation. So that's very, very important, Homer. And I was very keen to point out to the president the chair for the committee, Lucia Thomas Francis, that sometimes most people believe that these awards are really for older folk, the more senior members of the society, but not so. And increasingly we've seen young people being awarded and just being celebrated for putting nation building, as a focal point in everything that they do in their lives. So please go out there, identify St. Lucians, both here and abroad, as well as individuals. They may not be citizens of St. Lucia, but individuals who have adopted St. Lucia as a homeland and they've been contributing to the development of the country. They too can be nominated. And so let's just celebrate excellence.
Very good, Lisa. Thank you for remembering to put that one in, because it really is important that the hard work of our people be celebrated. Whether you're right, whether they're here, whether they're abroad, whether they're not necessarily St. Lucian, but they're contributing to our country, because I think a lot of the times these things go unnoticed, and especially the people who do not do it for the recognition. I think these are the people who deserve it the most.
They deserve it the most. And I always think that the diaspora, lots of things have been done by St. Lucians in the diaspora, and sometimes that goes unsung because, of course, they're not onshore and they do not look for any sort of gratification from that. They don't want any, as you say, guabagai, fete, pisa, And so they do it very quietly, but it is important for us to celebrate them. And that celebration of these individuals really inspires others.
True.
So it creates a sort of influence for other people to say, well, okay, this one is making that contribution. And oftentimes, Homer, we think of making a contribution and we think of it in a grand fashion. So if you feel that it's not something that's being done en masse, it's not big, then you're not making a contribution. Not so at all, because just remember, every little counts to the bigger picture, and that's the important thing.
You're so right. You say that, and I remember there's a story of the little boy on the beach with the starfish. I don't know if you've heard of it, but there's story where a little boy was on the beach and there was starfish just laying all over the beach, and he used to take them and just fly them back into the ocean. So a man saw him doing it and asked, why are you doing this? It's not going to make a difference, because thousands of starfish are washed ashore and they die. So doing that is not going to make a difference. And he looked at the man and he threw the next starfish and he said, well, it made a difference to that starfish. That's one of the stories that I heard that stuck with me. And so you're right. You may think that your contribution is not making much of a difference. It's not changing the world. It's not saving the world. But the goal is not to save the world. It's to touch one life.
Yeah, touch one life, And I always think of it I remember when we used to have these telethons $1, and the concept is that if we, our population, approximately 180,000 people, and just imagine someone in need, whether it be for some surgery they can't pay for and so forth, a house is burnt and that sort of thing. Can you imagine if each of us were to just give that $1? Yeah? So you see the impact. So it's just $1. But if each of us were to do just that, you see that the impact is certainly a big one.
I think about that every time I go on social media. If every one of my social media friends, my followers, just contributes $1.
Yeah, look at that. So, we'd all have equity in that business that you are now thinking of. I mean, you just stepped right into that one, huh?
I did. I really did. I really did. I'm not even going to complain about that.
So now that I know that, you know what I'm thinking now.
Oh, Lord. You know what, Lisa?
Let's get to the COVID numbers. Something light, take a little pressure off, because it has been a very, trying week. It's been a very gloomy with the escalating numbers for COVID-19. Expected, but still, when the reality hits, it hits.
It really does.
So tell us what those numbers were overnight.
Yeah, that's sobering. Eh? Going back to the COVID-19 numbers, yesterday the Ministry of Health, Wellness and Elderly Affairs confirmed a total of 568 new cases of COVID-19. Those were processed on Wednesday, that is January 12th, 2022, at the Ezra Long Laboratory, as well as Laboratory Services and Consultations Limited, from a total of 1,197 samples, which were collected from January 10th, 2022 to January 12th. So that's over a span of a course of 2 days. This number brings the number of positive cases. It makes up just about 47.45% of all samples processed on that date, which is the positivity rate we've been seeing for the past few weeks since the start of the fifth wave. Confirmation was also received of the recovery of 70 individuals diagnosed with COVID-19, and this brings the number of active cases in country to 2,498. Currently, there are 20 positive cases of COVID-19 admitted at the respiratory hospital, of which one of these active cases is in critical care and 3 of them are severely ill. Vaccination continues today, the 14th of January 2022, at the VG Sports Complex, the Grosley Human Resource Center, the Soufriere Hospital, the Jackman Wellness Center, Care, that is in VA4, and St. Anthony's Medical Center in Sunny Acres. And you could get vaccinated between the hours of 9 a.m. today and 4 p.m.
Yeah, good. And so, the plea is for us to be able to go out there, and I say us because it's a nation as a whole, go out there and get yourself vaccinated. Don't forget, you have questions as we discussed with Dr. Merle Clark. So again, you can review that conversation. Conditions that you may believe that you have, be specific with your doctor and discuss in detail what your condition is and whether taking the vaccine is going to have any sort of adverse effect for you. Because again, these are the thoughts that individuals have very quietly, or you may hear a friend talk about some incident, the stories are floating around, and it leads to the vaccine hesitancy. So in order for us to be able to break through that wall, we need to discuss what those issues are. And so don't be shy, speak to a doctor, your doctor, about what it is that's affecting you, and again discuss with the doctor, because what Dr. Merle Clark was emphasizing, that it's not the vaccine, perhaps components what the vaccine is made out of, you may be allergic to it, and so discuss that. Ask the doctor to break it down for you, because we don't have that medical training, right? And so even if you were to see what the vaccine is made, go on Google and you'll see that you can't understand what that is. So speak to a medical professional and they'll be able to help you out in understanding that. Now, Herma, the year has started, and it's, that the international health organizations, they are continuing with their efforts in being able to coordinate what it is that we here in St. Lucia do, because, it is a global fight, and whatever it is that we're doing here in St. Lucia, we're not doing it on our own accord or, trying to wave some magic wand there, because COVID-19 has made it that we need to depend on other agencies, those agencies that have the resources that we don't have, the scientists that we don't have. And so we're taking that cue, the direction, the support, from these organizations. So the Pan American Health Organization, they had the press briefing, the first for the year, and we will be getting to a statement from the director of the Pan American Health Organization, who is Dr. Carissa Etienne, momentarily. But just to let you know that the vaccination coverage in Latin America and the Caribbean is now at almost 60%. And so countries like Chile, Cuba, Argentina, they have some of the highest coverage rates in the world right now. And in the Caribbean, Puerto Rico and the Dominican Republic, they are experiencing new hikes for new infections. And we've seen the increases in Jamaica as well, Aruba, Curacao, and Martinique. In Central America, Belize and Panama, they also reporting the highest incidence of COVID. And in South America, increases are particularly pronounced in Bolivia, Ecuador, Peru, Brazil, as well as in Argentina and Paraguay, where new cases have increased by 300%. And I know oftentimes we don't think of our neighbors to the south, but that's important as well, because that area, that region there, when it comes to shipping and so forth, we are affected. Right. When we talk about, the breaking chains and so forth, all of that, the complexity. So the region as a whole, from the north to the central to the south, that's important to our own existence. And in the last week, countries in the Americas, they've reported 6.1 million new cases of COVID-19. That's a 250% increase over the same period last year. So what does that tell us? That the Omicron variant, it's now detected in 42 countries and territories in this region. So they're believing that the 6.1 million new cases are really attributable to the Omicron variant. So we want to go now to the statement by Dr. Carissa Etienne, who's the director for the Pan American Health Organization, at this first press briefing for the year.
Since the start of this pandemic, nearly 300 million people around the world have been infected with COVID-19. And the virus has quickly picked up pace over the holiday season, reaching levels of transmission never seen before during this pandemic. Over the past week, COVID infections have nearly doubled in the region of the Americas, rising from 3.4 million on January 1st to 6.1 million on January 8th. To compare with last year, during the week ending January 8, 2021, the Americas had reported a total of 2.4 million cases, while this year, by the same date, there were 6 million reported cases, representing a 250% increase year to year. Infections are accelerating across every corner of the Americas. And once again, our health systems are being challenged as emergency room visits and hospitalizations are rising. Nonetheless, thanks to the protective power of vaccines, in fact, COVID deaths are not rising with the current wave of infections. The United States is reporting the bulk of new cases, where its eastern and midwestern states are experiencing a rapid surge. In Canada, cases are also picking up speed in its eastern provinces. In the Caribbean, Puerto Rico and the Dominican Republic are reporting the highest numbers of new infections. Although other islands like Jamaica, Aruba, Curacao, and Martinique are also seeing significant jumps in COVID cases. Meanwhile, Belize and Panama are reporting the highest incidence of COVID in Central America. Further south, Bolivia, Ecuador, Peru, and Brazil are experiencing significant increases in new cases. COVID hospitalizations are also up throughout Brazil, particularly in densely populated states around the central and eastern parts of the country. In Argentina and Paraguay, COVID infections have increased by nearly 300% over the last week. Today, of course, all eyes are on Omicron, which has reached nearly every country in the world. 42 countries and territories in all subregions of the Americas, North America, Central America, South America, and the Caribbean, have already detected the Omicron variant. Since countries are already experiencing widespread community transmission, as Omicron spreads more quickly than other detected variants, and more likely via airborne transmission in closed spaces. And And while Delta is still causing new infections in the Americas, based on current trends, Omicron is on track to become the dominant strain in our region. It also has led to a rise in reinfections, even among those who are fully vaccinated. This new wave of infections, it won't be mild for our health systems, as the Omicron variant is already challenging our health workforce and limiting care for other diseases. In smaller island states, some hospitals were already strained by cases of the Delta variant, and now more hospitals face the prospect of being overwhelmed with cases. One of the characteristics that sets Omicron apart seems to be less severe symptoms. But even so, Omicron infections can be lethal, especially for the immunocompromised and the unvaccinated. So the time to act is now, using the many tools that we now have at hand. Prioritizing symptomatic individuals for testing and making rational use of these resources is critical to catch infections quickly and early. Maintaining and reinforcing the public health measures is paramount to slow transmission. The PCR and rapid antigen tests recommended by PAHO remain effective at detecting the Omicron variant. So countries should continue to use existing protocols with rational use of tests. PAHO's strategic fund makes COVID tests available at low prices, so countries should take advantage of this resource. Vaccines are especially important as Omicron takes hold. Countries in the Americas have been working diligently to secure the vaccines that they need to protect their population. And thanks to their efforts, nearly 60% of people in Latin America and the Caribbean have been fully vaccinated with 2 doses. And many countries in our region, like Chile, Cuba, and Argentina, have some of the highest vaccination coverage rates in the world. Vaccines are helping to save lives, and expanding equitable coverage everywhere remains our priority. WHO's expert group, the SAGE, has also called for vaccination strategies optimized for prevention of severe disease, including the targeted use of booster vaccination. This applies to people at high risk of complications and healthcare workers who are more exposed to the virus. We must continue to protect our health workers. Our region's ability to respond and overcome this pandemic depends on men and women who staff our primary healthcare centers, clinics, and hospitals. As health professionals everywhere handle the influx of new cases requiring immediate care, we must make sure that they are protected from the worst consequences of this virus. Wherever enough vaccines are available, health workers should be prioritized for an additional COVID vaccine dose. Additional doses are safe and effective and will help reinforce health workers' ability to withstand exposure to the virus, especially now that infections are rising. 39 countries and territories in the Americas have been rolling out additional doses to ensure their populations, including health workers, remain protected. But protecting our health workers cannot stop there. We urge countries to ensure that they have the right protective equipment so our health workers can do their job safely. With a virus as transmissible as this one, effective and well-fitted masks help us all stay safe. So we urge countries to provide their health workers with the PAHO WHO recommended protective equipment, including masks, with the highest filtration capacity. While COVID continues to spread in our region, we remind everyone that our goal has always been to protect each other from the most serious symptoms so we can save lives and prevent deaths from COVID infections. And saving lives remains our highest priority. Once again, we must slow down new infections to avoid overwhelming our health systems. Governments must act, guided by evidence, to limit new infections. And we all have a personal responsibility to keep each other safe by following proven public health measures like mask wearing, social distancing, and avoiding large gatherings, by getting vaccinated when it's our turn, and by getting tested if we suspect that we are sick. Our collective actions against this virus have the power to change its course. Whether we are fighting for vaccine equity, supporting our health workers, or doing our part to reduce the risk of transmission, solidarity will pave our way out of the pandemic.
The director there for the Pan American Health Organization, Dr. Carissa Etienne, giving us some very stark statistics when it comes to COVID-19, new infections, and speaking there to the importance of the management, containment, how do you do so, how do you manage the prevention measures, and of course, the vaccine remains at that central key point. So we also have the WHO, and we heard Dr. Etienne make mention of the special technical team that is sort of spearheading what that global effort against COVID-19 is, the SAGE. And so now we go across to the latest briefing from the WHO as they focus on COVID-19 as well as the Omicron variant.
With this, we're ready to go, and I'm handing to Director General for the opening remarks.
Thank you, Christian. Good morning, good afternoon, and good evening. Last week, more than 15 million new cases of COVID-19 were reported to WHO from around the world. By far, the most cases reported in a single week. And we know this is an underestimate. This huge spike in infections is being driven by the Omicron variant, which is rapidly replacing Delta in almost all countries. However, the number of weekly reported deaths has remained stable since October last year, at an average of 48,000 deaths a week. While the number of patients being hospitalized is increasing in most countries, it's not at the level seen in previous waves. This is possibly due to the reduced severity of Omicron, as well as widespread immunity from vaccination or previous infection. But let's be clear, while Omicron causes less severe disease than Delta, it remains a dangerous virus, particularly for those who are unvaccinated. Almost 50,000 deaths a week is 50,000 deaths too many. Learning to live with this virus does not mean we can or should accept this number of deaths. We must not allow this virus a free ride or wave the white flag, especially when so many people around the world remain unvaccinated. In Africa, more than 85% of people are yet to receive a single dose of vaccine. We cannot end the acute phase of the pandemic unless we close this gap. We're making progress. In December, COVAX shipped more than double the number of doses it shipped in November. And in the coming days, we expect COVAX to ship its 1 billionth vaccine dose. Some of the supply constraints we faced last year are now starting to ease, but we still have a long way to go to reach our target of vaccinating 70% of the population of every country by the middle of this year. 90 countries have still not reached the 40% target, and 36 of those countries have vaccinated less than 10% of their populations. WHO and our partners are actively supporting these countries to overcome the bottlenecks they face in leadership and coordination, lack of supply visibility, short shelf life of donated vaccines, limited cold chain capacity, vaccine confidence, health worker shortage, and competing priorities. WHO is also paying careful attention to the impact of Omicron on vaccines. In September last year, WHO established the Technical Advisory Group on COVID-19 Vaccine Composition, or TACOVAC, a group of experts to review the implications of variants of concern on the composition of vaccines. Yesterday, TACOVAC emphasized the urgent need for broader access to the vaccines we have, and that further vaccines are needed that have a greater impact on preventing infection and transmission. Until such vaccines are developed, the composition of current COVID-19 vaccines may need to be updated to ensure they continue to provide WHO-recommended levels of protection against infection and disease. TACOVAC also said that a vaccination strategy based on repeated booster doses of the original vaccine composition is unlikely to be sustainable. The group also emphasized that while some countries recommend boosters, the immediate priority for the world is accelerating access to primary vaccination, particularly for groups at greater risk of developing severe disease. The overwhelming majority of people admitted to hospitals around the world are unvaccinated. While vaccines remain very effective at preventing severe disease and death, they do not fully prevent transmission. More transmission means more hospitalizations, more deaths, more people off work, including teachers and health workers, and more risk of another variant emerging that's even more transmissible and more deadly than Omicron. The sheer number of cases also means more pressure on already overburdened and exhausted health workers. Protecting those most at risk also helps to protect health systems and health workers, which are once again under increased strain because of the burden of Omicron. A study published last year showed that more than 1 in 4 health workers globally have experienced mental health issues during the pandemic. And data from several countries show that many health workers have considered leaving or have left their jobs because of poor working conditions, insufficient staffing, and the distress of making life and death decisions every day under intense pressure. Health workers have done their best to protect us for 2 years. We must all do our part to protect them by getting vaccinated and by taking precautions to prevent becoming infected or infecting someone else. And we must remember that COVID-19 is only one challenge that health workers face every day. Taking the pressure off health systems will enable them to deal with the many other challenges they face, including providing care for pregnant women. Yesterday, WHO hosted a global webinar attended by clinicians from around the world on the clinical management of COVID-19 during pregnancy, childbirth, and the early postnatal period. Pregnant women are not a higher risk of contracting COVID-19, but if they're infected, they're at higher risk for severe disease. That's why it's vital that pregnant women in all countries have access to vaccines to protect their own lives and those of their babies. We also call for pregnant women to be included in clinical trials for new treatments and vaccines. Fortunately, mother-to-baby transmission in utero or during birth is very rare, and no active virus has been identified in breast milk. We are also concerned by reports from some countries about women who have been separated from their newborn babies, which is unnecessary and can be harmful to the health and well-being of newborns during the critical first days after birth. All women have the right to a safe and positive pregnancy and childbirth experience and need high-quality, respectful maternity care. Christian, back to you.
No, go to the lady.
Thank you very much, Dr. Tedros. Let me now open the floor to questions from the media. The first on my list is Jason Boubian from NPR. Jason, please unmute yourself.
Yeah, thanks a lot for taking my question. As Dr. Tedros just mentioned, there are 36 countries in the world that have less than 10% of their population vaccinated.
Can I ask you to speak up a bit, because it's really hard to understand?
Yes. Okay, I'll talk louder. I hope this is better.
That's good.
As Dr. Tedros just mentioned, there are 36 countries that have less than 10% of their populations fully vaccinated. We have heard a lot about access to vaccine as a barrier, but I'm wondering if you can talk a bit more about particularly those countries that have really struggled to get above 10% vaccinated, and what are some of the other issues that are leading to some of these low vaccination rates?
Thank you very much, and I think we'll start with Dr. Mike Ryan. No? Oh, Kate O'Brien, of course, the Director for Immunization, Vaccines and Biologicals.
Thanks so much for this question. This is such a critical issue because countries that are struggling to get even above 10%, what this really means is that healthcare workers are not fully vaccinated yet. It means that those who are in older age populations, those who have underlying medical conditions, these are the people at highest risk, are not fully protected yet. And so the reasons for countries which are below 10% are actually quite a wide range of reasons. First and foremost, the reason is around supply that has been constrained, as you well know, over this past year. And any vaccine program is going to struggle to stand up a program if it doesn't know when it's getting doses, how many doses, of which product. So that is sort of the underpinning, the sort of foundational issue that many countries are struggling with. But beyond that, there are a number of issues. And these are in no particular order, but are a range of things that countries struggle with. The first is on financing. A campaign like a COVID vaccine campaign does require funding to deploy to new health workers, to assure that the clinics have the resources that they need, the campaigns have the resources. And securing the funding in a timely and in a predictable way is really important. The second is that many of these countries have weak health systems to start with, or are in conflict settings or in fragile settings. There may be humanitarian emergencies, there may be other issues that the country is struggling with. And so to add on to the deployment of all health services, these other things, healthcare workers who are the ones who need to actually deploy vaccines. Countries are also facing concerns from populations about the vaccines that are being received and deployed into countries. And we've seen a lot of different countries making choices around vaccines. And these are issues of concern to people in the country as well. The other thing is the really strong commitment from leadership of countries around what their targets are, and having decisions in countries about exactly what the targets will be in what time frame. And that's what I think is so helpful about the targets that have been set by WHO to help guide countries around what the trajectory might be. And then a couple of other things that I would mention is certainly the cold chain capacity, where there have been a lot of investments to help countries increase that cold chain capacity to be able to secure not only what is needed for these vaccines, but for other commodities that are coming through in the country. So these are a range of issues that there's no one specific problem that is across all of the countries. It really is a country-by-country tailoring of understanding exactly what the country needs to be able to help the country accelerate vaccination. And we have seen that acceleration, especially when supply is secured and is in a predictable way. Many of the other pieces fall into place.
Thank you very much. And Dr. Bruce Aylward, please.
Thank you very much, Christian. And Jason, thanks for this really important question, because there's a dangerous narrative emerging in many high-income and high-coverage countries about the low vaccination rates in some lower-income countries or countries with weak immunization or health systems. And that narrative is, you're hearing more and more, is countries that can't use these vaccines, or countries don't want these vaccines, as you mentioned. And so there's 2 points just to emphasize further to what Kate said, Jason. The first is, if you look at those maps and then look at a map of polio around the world or measles, and you'll see that the same countries that have got very low coverage for COVID-19 have eliminated or eradicated polio or eliminated measles or achieved very high routine immunization from other diseases. And so then, Jason, we got to stand back and say, okay, why is that? And a big part of the problem is we've made it twice as hard or 3 times as hard for low-income countries, many of them, to be able to achieve high coverage. We have to be really clear on that. Well, we did not share vaccines for 6 months, 7 months, 8 months. What we did share was a lot of misinformation, a lot of bad practice, a lot of problems. So now, as we are starting to get vaccines, and huge recognition of the work of COVAX, as the Director General mentioned, that the organizations working together will have shipped nearly 1 billion doses, 980 million doses as of today. So watch that number. But that demonstrates COVAX can deliver and deliver at scale and get vaccines to these countries. But the challenge we have now is it's very late. And these countries have a much more difficult problem because they're dealing with the challenges around information. They've not had the investments always in the financing side, as Kate said. And then they've also had the problems associated with some of the donated products. Some countries are sending vaccines that they don't want, and low-income countries know that, and then they have to work with their own populations. They're getting vaccines that have got short expiry dates, which make them very, very difficult to use in complex environments, and expiry dates that are shorter than the countries donating them will actually accept themselves often. So I just want to be, very frank, Jason, that these are countries that have, many of them that are red on the map, have achieved very high coverage for immunization against other diseases and eradicate and eliminate diseases. They know how to run vaccination at scale. It's really tough environment they're operating in right now. How do we fix that? Number one, we have to provide full support, the financing for the delivery, the information support, the right products, the right timeframes. There's so much we can do because these countries know how to get to their populations. They know how to turn on the machinery. They know how to get people vaccinated. They have a fantastic track record, most of them.
Thank you very much, both. Next question goes to Jamil Shad from O Estado de Sao Paulo. Jamil, please unmute yourself.
Yes, hello to everyone. My question, if you allow, Christian, will be in Portuguese because I have to read a statement by President Bolsonaro on Omicron. Is that okay if I do it in Portuguese?
Let us try if that works. Yes, please. We should have Portuguese translation.
Very good. So the statement is by President Bolsonaro made today.
Omicron has already gone around the whole world, and those who have had it said that it is very fast at spreading, but it doesn't have major complications. According to some people who are serious and not linked to the pharmaceutical companies, they say that Omicron is welcome and could be the end of the pandemic.
The fact that President Bolsonaro claims that it has not killed anyone, that Omicron has not killed anyone, and that it could be a vaccinal virus and is welcome, is this a statement that, let's say, tranquilizes you all? Thank you.
Jamil, can I ask you to repeat your question as such, please, because we're not quite clear what you're asking.
My question is Omicron welcome, as said by President Bolsonaro today? And is it true that it has not killed anyone?
Thank you very much. I'm asking Dr. Mike Ryan to start.
Sorry, thank you. No, I'm not aware of any such statements, but I think the Director General was clear in his remarks that while Omicron may be less severe as an individual virus infection in an individual, that this does not mean this is a mild disease. And there are many, many people around the world as we speak in hospital, in ICUs, on ventilators, gasping for their breath on oxygen, who would obviously be very clear that this is not a mild disease. It is a vaccine preventable disease. It is a disease that can be prevented by taking, to a great extent, by taking strong personal precautions to avoid infection, getting vaccinated, and there are things we can do about it. And I think it's very, very important that we remember that it's still in our hands. Maria says this a lot, the Director General says this a lot. There's much we can do, and this is not the time to give up. This is not the time to give in. This is not the time to declare that this is a welcome virus. No virus is welcome that kills people, and especially when that's to a great extent, that mortality and that suffering is preventable through the appropriate use of vaccinations. So I'm not aware of the specific comments made by any individual on this, but I will point you to the comments made by the Director General in his speech.
Thank you very much, Dr. Ryan. We'll move to the next, and that's Bayram Altuk from Anadolu News Agency. Bayram, please unmute yourself.
Thank you, Christian, for taking my question. Hans Kluge, the WHO's Europe director, said yesterday that more than 50% of Europe's population will be infected with the Omicron variant in the next 6-8 weeks. So does this scenario apply to the whole world? In other words, do you expect, as WHO Geneva headquarters, that more than half of the world's population will be infected with Omicron variant in the next 2 months if the current trends and rates continue? If your answer is yes, are we able to see a light at the end of the tunnel? Or is there a realistic hope that the pandemic will end soon because of mass immunity issue? Thank you.
Thank you very much, Bayram. Let's start with Dr. Maria van Kerkhove.
Yes, thank you. So you're referring to comments made by our RD Euro director on a model that was looking at future scenarios of COVID-19, in particular the Omicron variant and circulation of the Omicron variant. What we definitely see with this variant is that it transmits incredibly efficiently between people. And you've seen that in the epidemic curve that we published last night online, and the Director General comment today. More than 15 million cases reported in a 7-day period. We had to change the scale of the epidemic curve that we published last night because it's such an astounding number. And certainly, if we allow this virus to continue to spread as it is, we will see higher numbers of cases in the coming weeks. I think the point of us sitting up here and speaking every day and doing these press conferences, issuing guidance, issuing strategies, is that we have tools at hand that can prevent something that's predicted in a model from actually happening. We said this in the beginning of this pandemic. There were a lot of models that came out that gave very scary predictions about what would happen if we didn't act, if we didn't take this as seriously as it needed to be taken. We're in that situation again. There is no inevitability about this virus and how it circulates. We have control, some measure of control in terms of limiting its spread with tools that we have access to. Masks, distancing, ventilation, avoiding crowds, knowing what our risk is every day and taking measures to lower that risk. At the present time, we're not able to prevent all infections, but we can limit the spread and we can reduce the sheer number of cases that are occurring right now. We can also reduce the severity of COVID-19 with vaccination, with earlier clinical care, with access to diagnosis to get patients into the clinical care pathway so that they can receive earlier clinical care. So I think we need to look at these models as ways to help us plan, as ways to look at scenarios going forward. And we as WHO are looking at a number of different models, a number of different future scenarios in terms of case predictions, in terms of hospitalizations and deaths, also looking at potential scenarios of how much further this virus will evolve, because the virus is spreading and it's continuing to evolve. But these models are just that. They are tools that help us plan and take direction and take action. So what we are asking is everyone to help us reduce the spread, because the sheer volume of cases is putting a burden on healthcare systems. Because even though Omicron is less severe than Delta, it still is putting people in hospital. It is still putting people into ICU and needing advanced clinical care. It is still killing people. And so the more people that end up in hospital and fill up those beds from COVID-19, they take beds away from other emergencies that need to be cared for as well. And our healthcare systems around the world are significantly overburdened. So we need everyone's help right now to, as Bruce says often, to take the heat out of this epidemic that we're in right now, the latest wave of infections that we see. And we don't have to actually have these models come to fruition.
So Dr.
That giving you a more extensive understanding of what's happening globally, and the press conference there focusing heavily on Omicron from the World Health Organization. And it really does give us that broader context of what it is we are facing here in St. Lucia, what it is that our Ministry of Health, some of the measures that are being instituted. So it gives us the full picture understanding that COVID-19, it's not a St. Lucia thing. It is a global, across the world, and we heard that. 15 million cases in 7 days, new infections in the 7-day period. And so Omicron, as you would have heard the WHO specialists say, I mean, this is some serious stuff, and it's the manner in which the world is being overwhelmed. And she put it quite into context by saying that, listen, if we have to deal with all of these new infections and people have to be hospitalized and they need to go into critical care, that is taken away from all of the other health conditions that people are facing on a day-to-day basis. And Dr. Clark, yesterday in our own conversation, did make mention of that if everybody, coming in for COVID-19, then what's going to happen with our cancer patients, people who have kidney diseases and so forth? We are really, truly exposed.
You're right, Lisa, and it really does put it into context for us. The Ministry of Health press conference that was held this week, we heard the Chief Medical Officer indicate that where we do not have evidence that Omicron is in country, but we're operating as if the number of cases that we're seeing is as a result of Omicron. We're operating as if Omicron is already in country, and I understand that because...
And I think it's just a matter of the confirmation for the gene sequencing, because we know that we don't have that capability here. So the OCS countries, a number of countries across the Caribbean, they're sending down samples to CARFA for that confirmation. And so we are waiting the results to come through. But as the CMO would have pointed out, that just looking at the manner in which we've seen those rapid cases and looking at the disease itself, you can definitely, an educated guess can be made that, you know, the likelihood of Omicron here is very possible.
And another important point I think that is being made is, while, yes, you're seeing a lot of the rapid rate in which it's being transmitted, you're not seeing that many persons falling as ill. It is still very, very, it should not be taken lightly. It should not be considered milder due to how quickly it spreads and the implications, like you mentioned earlier, that can cause. So we do still need to be taking the measures that we know works, ensuring that you're sanitizing surfaces, frequently touched surfaces at work. I think some of the things that we started doing in the beginning, we may have gotten a little laissez-faire when it comes to that. But ensuring that you're taking the measures, social distancing, wearing your masks when in public, whether or not you're vaccinated, because remember, vaccinated persons can still transmit the virus. You could still receive the virus, whether or not your viral load may be lower, it still can happen. So you want to ensure that you're taking those measures, you're washing your hands, you're sanitizing in the absence of soap and water. These measures are very, very important. And like Dr. Moore-Clark mentioned yesterday, one of the things that you want to ensure that you're doing is maintaining a healthy lifestyle, because she did quite clarify that your immune system and boosting your immune system is not a one-time, let me just go to the pharmacy and get vitamin C, or let me just go to the pharmacy and get a supplement. It's the lifestyle and ensuring that you're maintaining a healthy lifestyle. That is what you want to look towards.
Especially for the vaccinated, because I think I come across vaccinated people and they're so lax because they figure, oh, you know, I have the vaccine and I'm all good. And it's important for the vaccinated to continue to wear the mask and do all of those protocols, because, and I know of instances where vaccinated individuals having visited sick family members, and lo and behold, that they were positive, and because they're vaccinated, they're not really having that severe illness from COVID-19, and you know, they're asymptomatic and unknowingly passing it on to this exceedingly ill family member. And I can only imagine the trauma, knowing that you would have further endangered the life of a family member who's very seriously ill. So we don't want to have any of those scenarios continue in the country. So just continue to follow the protocols. The weekend is here. Continue to do your social distancing, continue to sanitize, continue to wear the mask, get yourself vaccinated, get all the information that you need. And most importantly, please follow all of the protocols when you go out. Respect the limits in numbers you know, whether you go to a store or if you're out at a restaurant or something, please observe all protocols and measures, because it is indeed for your safety, the safety of your family, and the safety of all of us as a nation. Yes, wonderful. So, Herma, we'll be back here, God willing, Monday morning.
Monday morning.
Monday morning.
Yes.
See you then.
Sector. We also saw to a certain extent fruit trees, root crops, vegetables were also affected in the crop extension area. In terms of fisheries, we saw that there was